You're watching a special edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, how to restore and maintain a youthful appearance with some of the new techniques that are available. If you are not happy with the way you are aging, and by the way, this is going to be a very interesting show today. We're changing it up today. And with us, we have a board-certified facial plastic surgeon that is world-renowned. So if you're not happy with the way you're aging, my advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, how to restore and maintain your youthful appearance. With us, we have an expert on the topic, board-certified facial plastic surgeon, Dr. Gregory Keller. Dr. Keller, always a pleasure to have you on the show.
Always a pleasure to be here, Randy.
Now, before we get into today's topic, because I guess there's a lot of new technology, new techniques that are, I guess, allowing for even more natural appearances for facial rejuvenation. But for those who don't know you, tell us a little bit about your practice. I mean, what kind of patients do you see?
Well, my practice is really all ages, Randy. I mean, we have the young girl who's interested in a rhinoplasty. We have people who want to maintain their skin and keep that in shape with its natural color, texture, and appearance. We have people who are a little older who want to do something about their eyes. We have older people who want to do and lift the face, which occurs mainly around the time of menopause, but can occur earlier.
Okay.
Mid-facelifts, there are all kinds of things and all kinds of ages that we deal with.
Let's begin with the younger patient. I mean, at what age are they coming in now to do
Well,
things?
they come in at all ages now, Randy. You know, you'll have younger people with acne. We have devices that'll really help that and clear things up, whereas before Accutane was a necessity. People will come in when they start to notice pores or little wrinkles, and there are a lot of tools, Botox, intense pulse light, and the newer fractionated resurfacing devices that can really help that. These are things with minimal or little downtime or risk that can really make a difference.
Okay, now, do you think there's a benefit, and we talked a little bit about this off camera, of going to somebody that does both? When people ask me, I said, if you're going to go, and this is what I've learned after doing over 1,000 of these shows, is that go to somebody that both does facelifting, but also does fillers and all the minimally invasive stuff. So that way they give you an honest opinion. They can't help but tell you what's best for you. I mean, is that the way you feel? Is that accurate?
There's an old saying on that, actually, that if you have a hammer, everything looks like a nail. You know, so if you have one thing to do, everything looks like that's what you ought to do. I think it's good to have a repertoire of things that you can fit to the individual patient and tailor for their specific program to maintain and restore their youthful appearance.
Okay, so it's not just all about adding volume, adding fillers. Because I have people on the show, let's say it's a dermatologist, who says it's all about volume. Add volume, you look younger. What are your thoughts on that? I mean, define the young, the youthful face. How do you keep it?
Well, you know, it's a variety of things. As we age, different things happen. The first things happen in the mid-face. The middle part of the face can sag. Can you cover that over with volume? Yeah, but you can also look like you have a rock in the sock type of appearance. So a little volume can be helpful, but it's also helpful to pick those fallen structures up. And if you get people early enough and maintain that, you can do that with a very minimally invasive type of procedure with new devices that Coapt and other people make.
Okay, so you do a mid-face. So now for nasolabial folds, that seems to be what a lot of women that we interview are worried about. Fillers, do you do fillers or do you do a mid-facelift? What do you do?
Well, you know, the nasolabial fold is a very complex thing. There's loss of volume, there's loss of structure, and there's sagging that goes into that. So we try and attack that with a little bit of this and a little bit of that to try to recreate and reformulate the way people used to look. And that's what I think is important. So the answer is we do all of that, but we do it in little volumes to make it look natural.
Do some people come in and say, you know, Dr. Keller, I need a facelift, and they really don't? I mean, do you ever have to talk somebody out of a facelift and do other things? I mean, does that ever happen?
There are those people, definitely. But I think people are becoming very well educated nowadays. And if someone comes in and says, I need a facelift, usually, not always, but usually it's true, they do.
Okay, okay.
Yeah, because the tendency is to try the less invasive things first, and often people have gone through all of that and really want to accomplish something that restores their youthful appearance and the way they feel inside.
Okay, now at the top of the show we talked about how to restore and maintain your youthful appearance. and I asked you off camera, and you said, well, I don't know if I want to say that on camera. But I said, could you make, if I stay with you and I take your advice, in 10 years from now, can I look younger than I look today? And you said yes. So you believe that?
I do. It depends on what you want to do to
Would I
keep
need a
that up.
facelift? Would I need a facelift to do that? Would I just need some of the laser or tightening procedures you use?
Well, I think in your case, Randy, the earliest signs of aging are in the middle part of the face.
Okay.
You know, this area right here. And that has to do with the way our ligaments sag, our ligaments stretch out, you know, because we have ligaments in the face that hold up our structures just like a shoulder. And
All
if
right.
you use that a lot and move it around, things are going to come
So you
down.
kind of lift that up a little bit?
You can lift that through minimally invasive things if you start early enough, or if you wait till later, then you know have to do a little more to
Are
do
these
that.
endoscopic procedures we're talking about?
They can be. They
Okay.
can be, yes. Endoscopic facelift for the younger woman where we make little incisions and lift things can be a very good thing. You can you know, there are people who think you have to rejuvenate the whole face, but really if you look, everybody ages a little differently and you need to tailor a neck. Men often want their neck done and their eyes. Those are the two things that tend to bother them the most. Women, on the other hand, want a balanced look. So everybody's different.
Do people want to look different? They want to look younger, prettier? What do they tell you? I mean, on the consult, do they say, I just want to look different, or I want to look prettier? What do they say?
They want to look like they used to look before it happened, because what happens to women particularly is that they age all of a sudden. And it's not directly connected with, but often correlated with menopause.
Okay.
Why they call it menopause, I don't know, you know, because it happens to women. But what happens is that, bam, something happens real quick. So women will see plateaus of aging that happen at various times that happen very quickly.
Okay, now you say early treatment is better. You say, Randy, you know, I want people to know that the earlier they get in, I mean, you could literally slow the appearance of aging or stop the aging process?
Well, you know, I didn't believe that early treatment was good when I started out, but I was young, you know.
All right.
I hadn't gone through menopause with all my friends and, you know, et cetera. But what happens is that if you do little things, you know, starting early, you can maintain your appearance without a doubt. Just so that you don't do too much, that can be a
So a person 40 that's
two-edged
watching
sword.
this, so we know that there's a 40-plus crowd, very sophisticated, that watches this show. A 40-year-old woman or man starts with you. You're saying you could probably make them look that age for 10, 15 more years? Without dramatic
Well, you don't know
stuff to
how
their
many
face?
years, but definitely you can keep up their appearance, no
You could
question.
slow it. You could stop it almost. The appearance
Yeah,
of aging.
you really can. It's really interesting. And technology is there, you know, whether I do it or someone else, that if you're really committed to doing that and maintaining and restoring your youthful appearance, you can do that for quite a while.
Okay, let's start with the minimally invasive, and I have questions about the facelift and mid-facelift and this co-op facelift. Okay, 40-plus woman or even mid-30 woman or man, where do you start as far as technology? They have some sun damage, I guess, just a typical person.
There are no typical people.
All right, okay, okay.
I mean, everybody's different. Everybody, particularly in California, which is a very diverse society, people have different skin textures, colors, aging, they've been in the sun different amounts. So there's a wide variety of people, but generally if you start early, you're going to start with fillers, with fractionated resurfacing, and we have the very latest type of techniques
This
with
is
that.
heating the underlying tissues and tightening the skin?
Well, partly it's heating little cones of tissue that are separated by normal skin.
So it's a laser or light?
In this case, it's a laser
Okay.
that's divided into little cones of energy. And in this case, a carbon dioxide or an erbium laser. We use both. It's fractionated resurfacing. And that's a quick healing process that really can make a difference in the skin texture and color. There's intense pulse light. There's combinations of all three, including radio frequency skin tightening. All these can maintain things for quite a while prior to doing anything else.
Do you have to have an eye for this, or does the machine do all the work? And that seems like an obvious one, but how much technique or eye does require the surgeon? You teach surgeons from all over the country.
Randy, I like to see every patient that comes through my door.
Okay.
But I like to tailor a program for them. Now, to save money and to make this economical for a lot of people, either RNs or physician's assistants can do some of the work, but I like to lay out the treatment plan so that it follows the thing. Then I like to see people afterwards to make sure that they're progressing in the direction that they want to go.
Okay, you imply you know, everybody's different, and I'm picking up on maybe there's a cookie cutter approach that's going on in the world of, you know, minimally invasive facial rejuvenation or cosmetic surgery. Is that going on? Because I tried to pin you down and said, okay, so where do you start? And you almost wouldn't say, because it depends on the person.
It absolutely does. You really have to tailor treatments. People come up with a name that they've heard on TV or that's been advertised. And I said, often if a doc has one tool, you know, he has a hammer and everything looks like a nail, you have to have a lot of tools and a lot of capabilities and a wide variety of things, you know, to really fit the person.
Okay, so you believe go to somebody that does both the fillers, has all the technology, lasers, IPL, these what do you call it?
Fractionated resurfacing, you know, they're